Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. Now, first, what is most urgent? Last week, the Senate passed a new healthcare funding package, including the components we highlighted in last week's update. While care at home, telehealth, and diabetes prevention all benefit from the package, it fails to extend enhanced premium subsidies, which rural populations rely on for affordable health insurance. A KFF Health poll reported that 2/3 of Americans disagree with Congress's failure to extend the subsidies. Already, hospitals across the country are seeing patient volumes decrease as patients drop their insurance plans. This cost barrier will have a dangerous impact on rural health access this year and beyond if actions are not taken. On to the damage report. On the same topic, healthcare costs have become a major concern for the American public, with more than half of families saying that they're more concerned about affording healthcare than utilities, food, housing, and even gas this year. Recent polls also reported healthcare cost increases will play a role in America's voting decisions in 2026. Between expiring ACA subsidies and other insurance changes, more than half of Americans expect healthcare to become more expensive, even with employer-sponsored insurance. A poll from just last week shows that prior authorization leads the various factors of healthcare cost concerns. Other factors include understanding a bill, getting appointments when they're needed, and finding providers that are actually accepting the right insurance. Lastly, in our damage report, a recent proposal of limiting federal loans for graduate programs to $20,500 per year will shrink the physician assistant workforce and make recruiting more difficult for hospitals in the years to come. Students are concerned about having to delay enrollment due to the loan cap, and one recent poll suggests many would-be PA students won't even go into the healthcare industry because of it. We'll be watching this proposal for future updates. And now for today's success story. We love to tell stories from all over the country about achievements and milestones in rural health. Today, I want to share with you a success story right here from Hillsdale Hospital that we hope will encourage our listeners working in healthcare. Everyone at Hillsdale Hospital knows the name Doris because of the leadership and legacy attached to it. Doris is a registered nurse, risk management director, recipient rights advisor, former patient advocate, and beloved community member. Breaking all previous records for our hospital and probably most others around the country, Doris has worked here for 57 years, dedicating each day to this community. She has been our ER manager, director of nursing, and so many other essential roles that she has faithfully trained others to do now. After many decades of devotion to our patients and staff, Doris is retiring this year. In honor of her legacy, we are naming our nursing scholarship after her to celebrate the generations of nurses she's taught and all the seasons she's led Hillsdale Hospital through, such as natural disasters, stock market crashes, new expansions and growth, and most importantly, the countless connections she's built with our patients. High school seniors in our area of Michigan pursuing an associate's or bachelor's degree of science in nursing to become an RN can apply for the Doris Worley Nursing Scholarship at hillsdalehospital.com/education. Thank you to our sources for this episode, the American Medical Association, NPR, KFF Health News, and Becker's Hospital Review.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.